If you twisted your knee, maybe felt a pop, and now you're thinking, maybe I've torn my ACL. Well, in this video, I'm going to give you 5 signs you might have torn your ACL, and an extra 2 tests you can do at home to give you a bit more of an idea. And number 3 is the one most people miss. I'm Aaron, a sports therapist that specialises in ACL injuries and treats them every day in this very clinic. If you think you've torn your ACL, or you've got a diagnosis that says you have, and you want to know a bit of a timeline of what to expect over the next few months, go to the link in the description below and fill out your details and it'll map it out for you. But back to the trusty ACL. So, number 1, think about how you did it. Most ACL injuries actually happen without impact. Things like landing from a jump, twisting and pushing away, changing direction quickly, planting your foot and twisting. And a really common mechanism of injury that I hear all the time in clinic is that someone planted the foot, twisted, turned to push away and felt a pop and their knee gave way. And if your injury happened a bit like that, then an ACL injury is already on the suspect list. Number 2 is a pop. A lot of people hear or feel a pop. Sometimes it's that loud. If it's done around other people, like in a football match, other players can hear it too. This doesn't happen every time, but if you've twisted, felt a pop, and you've got quite a lot of pain, then it's likely that it could be an ACL injury. Number 3, rapid swelling. ACL tears usually cause quite a lot of swelling within 1 to 2 hours, and that's caused by the ligament inside the knee rupturing and then bleeding within the joint, and then the knee balloons up. So if your knee's blown up like a balloon, that's unfortunately another classic ACL sign. Number 4 is the knee giving way. I've explained before that the ACL is a bit of a seatbelt to stop your knee doing that. So patients often describe the knee feels loose, it feels like it's going to collapse, they've lost a bit of stability, and that unstable feeling is another classic sign of an ACL injury. And the 5th one is loss of range of movement. So if you can't bend or straighten your knee as easily as you could before, then that's obviously a sign of an injury, and that could be an ACL injury. If there's swelling in the joint, that will sort of affect your range of movement. It could be due to pain, you don't want to move it that much because it hurts, or it could be muscle guarding, where the muscle stops you being able to do that to kind of protect itself. So if your knee suddenly feels stiff and you don't want to move it because of whatever reason, then that's another warning sign. So how do we check at home? There are some special tests that clinicians like to use, like the Lockman test and the anterior draw test, which is where we test whether the ligament's doing its job, which is to stop that movement. So if you've got extra movement, it might be a sign that it's damaged or is completely ruptured because it's not stopping that bone moving in that direction, which is what it's for. But it's pretty tricky to do at home, especially if you're not a clinician and you're not used to dealing with them every day. So here's a couple of little simple checks you can do yourself. Just stand and try to walk normally. If your knee feels unstable or it tries to buckle forward, as I explained, then that instability can indicate an ACL problem. The second simple check you can do is just compare each knee. If you lie flat and gently bend both knees, and then you can compare. You can compare what they look like, how they feel, the movement you've got in each one, if there's any pain, which kind of degree of movement you get pain. So if you're getting pain at this kind of degree of flexion in one leg but not the other, then that's obviously a sign that something is going wrong. And again, going back to stability, if one feels more unstable than the other, then that's a sign one of the ligaments is probably injured. So it's all about picking up little clues and building a picture as to what's happened. So if you've torn your ACL recently, I've created a free tool that shows you exactly where you should be in your recovery. And it will build a rough timeline based on your injury and whether or not you had surgery, and show you where you should be and how long it takes to fully recover. And you can get that in the description below. And if you want to hear more about the signs and symptoms of an ACL tear, then you can watch this video over here, which will talk you through 7 key symptoms of an ACL tear.